COVID isn't our first respiratory pandemic, epidemic in the past, 10, 15 years, right? We've
Right.
lived through Mars, we've lived MERS, we've lived through SARS.
Yep.
Obviously we've had Ebola, et cetera.
So hello and welcome to the Healthtech Marketing Podcast. I'm Adam Chirides and I'm your host for today. I'm the CEO and founder of Health Launchpad. And this podcast is presented to you by HIMSS and my company Health Launchpad. And I want to give a big thank you to you for joining us today. I think you're going to get a lot out of it. I've got a great guest who I'll introduce momentarily. Just a little bit of context. So why is it that we do this podcast? Well, the reason we do this is that, look, healthcare and selling to healthcare is incredibly hard. It's the hardest sector, in my view, to sell and market to. I just don't think there's anybody that's tougher to market to. And so we can all use a little bit of help. And so this podcast is an opportunity for you to get insights and practical advice for other leaders in the marketing world, in health tech and healthcare marketing. And so I've got a great guest for you today. A guy I've got to know a little bit over the last couple of months. I want to introduce to you Karsten Russell-Wood. Karsten is a long-time healthcare marketing and healthcare technology marketing guy. And he is the Chief Marketing and Experience Officer of Equum Medical. So Karsten, welcome to the podcast. Tell us a bit about yourself and tell us a bit about Equum Medical.
Adam, I like that intro. And congratulations for designing and innovating such a concept because as marketeers, we go through a journey, right? We begin eyes wide open, and sometimes, unfortunately, we narrow them because we think we know everything. And really, I think what hopefully we leave this podcast with is the urgency to continue to be curious and to learn. That's really what's driven my career, Adam, over the years. I started as a fresh, eyes wide open undergraduate and went right to work with GE, designing medical devices that were incredibly meaningful. And somewhere on that journey, I realized that it wasn't so much just the device, it was the data that was coursing through that device and being connected to other places. And so that led me from GE to Philips, which spent a decade in informatics and telehealth, really, as we think about transforming health in parallel to the innovations that have happened into a complete digital enterprise. And as COVID hit, and I think all of us spent the time to think about what was meaningful, I realized that I hadn't yet understood or even really experienced that final mile in care, which is spending time with providers and clinicians and really realizing what delivering care means. And so that purposeful move was to Equum Medical in September. And with it, really my eyes have opened again to realize how critical it is that we somehow tackle the great divide in equity in care accessibility across not only the US, but the more I learn, the same problems are endemic everywhere. So we are the provider people at Equum Medical. We bring telehealth-enabled provider services across many different service lines to health systems around the world.
So your customers are the provider organizations, is it primarily?
That's correct. So we're oriented primarily towards hospitals, health systems. But really, I think what's interesting is understanding that that isn't one segment and that isn't one customer. We can have the massive IDNs with affiliated hospitals, or we can have those standalone critical access or community hospitals. In fact, earlier today, I was on a call with one in Arizona, and the problems about leakage, losing customers, losing patients to a larger system, simply because they didn't have the capabilities locally to treat those patients. If you think what that means is, it means that we're going to have care deserts in the US because hospitals are going to close, because patients are just going to move past them, right? So I think we're at an absolutely interesting point where telehealth and technology are being able to bring those providers that ordinarily won't be in the small community hospitals to those hospitals, and through that, keeping those patients with care in their communities.
Really interesting. It's very interesting that the company that you're involved with, essentially, you were a service provider, a physician service provider. But I also think you're very much a digital company and a digital transformation company. And you and I have had this conversation about digital transformation. And I just think I'm really interested in your perspective, and particularly given the journey that you've been on, where you think, how do you think the healthcare systems are doing with this digital transformation journey?
I think healthcare in general has lagged other industries, especially lagged in innovation to consumer parallels. As we all have noticed, COVID was that catalyst. And I think hospitals and even providers, PCP offices realized that they needed to remove the barriers of location, which historically have been in-house. And they needed to be able to extend hospital-grade healthcare beyond the hospital and into the home. And this was the real beginning of that move directly to what we call, virtual first. And that is a new clinical workflow. It is replacing, not even augmenting, the standard of care. We see hospitals across the country looking at how to innovate emergency department surge capacity, or how to divert patients when their nurses are in short demand and they need to be able to manage higher volumes, or even try and have patients that are less sick be cared for in the home rather than in the hospital. There's, kind of that old story here of, if we build the Field of Dreams model, right? And Field of Dreams really shared this idea that if we build it, they will come. Now, what that meant was we would have these gleaming towers that everybody would drive to. And that phenomenon is now past us because of technology. We're not trying to build it and have people drive to it and center it. Instead, we're actually trying to distribute it. And in fact, through COVID, we've realized that probably is a better overall design of health and care.
So in the work that you guys are doing, you're seeing that organizations are essentially sort of distributing where the physicians are from being kind of like within a few a few miles of a patient to globally? And I mean, how are healthcare systems doing with that concept? I know obviously during COVID they had to out of necessity, but we're now entering a new phase with virtual first. And where do you think where we're at? Where do you think we're at right now, and where do you think we're going with that?
I think that's a good way to look at it. I think there was a need-based period where there was an urgency. COVID, right? We had to.
We
had to say our hospitals are closed. How do we reach our patient? And now I think there's a tolerance and acceptance period, which will transition finally to the adoption period. The reality is, across the United States, we do not distribute equitably providers, whether it's a doctor or a nurse, a pulmonologist, an intensivist, a neurologist. I can't just sprinkle them across the country and say, there we now have this, veritable Noah's Ark of clinical coverage. Instead, we see them populating the urban areas, the metropolitan areas, which makes obvious sense. Now, the reality is, even through some recent, administrative and policy changes, there is a big drive and incentive to help bring care to the communities, but that is only going to be temporary. And we know that it's not sustainable, primarily because supply and demand, which is, one of our most basic principles, isn't equal here, right? And so what we need to do is be able to satisfy the fact that less providers need to be able to see more patients where those patients are. And the only way that we can do that without re-architecting and re-engineering where people live is allowing technology to do it. And telehealth has absolutely been that gift to us, that while really it's over a quarter century of use in acute care, it's really only taken to prominence in the last decade or so.
Exactly. Yeah. And I think, you what you said is right. I think it's interesting. You use the word catalyst for COVID, and I think some people call it a disruptor. And I think catalyst is a better term, because it suggests it's not a transformation. There's nothing especially new that's come out of COVID, but it's accelerated a lot of different things. And I think virtual care is just a great case in point. It's been going for 10, 20 years. It's just taken an absolute necessity for it to happen. I think the other thing that we're seeing getting solved is part of the issue, part of the challenges with virtual care is that, you can't take vitals virtually, right? So there's a limit. There are some use cases and some specialties that virtual care lends itself particularly well, like telepsychiatry. But you can't yet perform a procedure virtually. But it is interesting though, sort of like it's also driving demand of remote monitoring and more devices being used in the home that wouldn't necessarily have been accepted and adopted. Mm.
Yeah, I think, Adam, I was actually doing some independent research on this, and not to be problematic, but I arrived at the idea that COVID isn't our first respiratory pandemic epidemic in the past 10, 15 years, right? We've right. lived through MERS, we've lived through SARS. Yep. Obviously we've had Ebola, et cetera. So we look at all these obviously mass casualty events, and we say, what have we learned and how have we changed? Now, COVID really was the first of those that had our hospitals realize that they were at the brink, right? They weren't going to make it. And so whether we call it a catalyst, I look at that word as to say, look, we realized that we needed to harness innovation to be able to change and adapt and be resilient. And I really feel as though that is a boon to how healthcare has adopted technology into clinical practice. And truly, I think it's been a very positive reception.
Yes, absolutely. Let's switch gears a bit and so talk more about the marketing issues. And I mean, you've been involved in business to business healthcare, sales and marketing for a while across some really interesting and significant organizations. And in many regards, some of those organizations are places where you learn, and you teach others, and they have sort of a they do things the right way. But what do you think, based on what you see right now, what do you think that sales and marketing people just get wrong consistently?
Well, I think, I've been in B2B healthcare marketing for quite a while. And I think what we have to appreciate is that health systems themselves are changing. And that's because our customers and the market itself is changing. And ultimately, many times we may rely on prior evidence, prior research, prior colleague PowerPoints that help segment the market and offer us personas, et cetera. And that is the easy, simple way of trying to understand what a market is. Today, for example, hospital marketing is advancing different themes. Hospitals today are focusing on education. They're focusing on safety, reassurance, just the human connection. So if we would say that our ROI, our value proposition is purely ROI, then we're missing what hospitals are trying to market today, which is experience. It's not just experience for the patient, it's also for their own providers, right? So I think the first thing we have to make sure of is that we are absolutely present and current with our audience and understanding the dynamics that are shifting. I think also what we see today is health systems are investing significantly in their identities within the community, and that's to differentiate their brand. As you mentioned about digitization and digital transformation, they're entering into the online marketplace of brands. And so strengthening an online brand for patients is a large task. It's not just about care delivery, it's about care experience. And so what we're also noticing here in B2B marketing, Adam, is that the roles that we speak to and try and reach out to are growing beyond the classic CXO structure of medical officer, operations officer, finance, and executive. Things like the chief digital officer.
Yeah.
How are we connecting information? That's not a CIO. This is a CDO. CDOs are very interesting groups that are bringing together not only medical experience, but actually a lot of times entrepreneurial experience.
Yep, absolutely.
And so we're talking to innovators, and those innovators will challenge a company whose marketing and positioning seems generic and undifferentiated. So I think, again, the most important thing right now is to personalize what we are trying to communicate. And many times in that personalization, it's not about a large swath segmentation. It's about really trying to understand the specific prospective customer. And at the end, as much as it is about sharing the value proposition to me of why Equum, I actually find I have remarkable conversations that customers appreciate when I say, why are we choosing you? Not that every customer is the perfect customer for us, but we're doing enough homework to realize that we need to make sure that you are also the right fit. Now, over time, what that gets to is the idea of partnerships. And partnerships in healthcare used to be a Rolodex of different vendors that a health system may be receiving different services for. But we also know that's going through an immense consolidation. Hospitals aren't trying to have 700 partners. They might try and have 70 all the way up to 7, right? Very strategic.
Yeah.
So to me right now, the best relationship is a disintermediated one, where I may not independently as an organization be able to offer the goods and services that complete my customers' needs, but I have the connections and the ability as a service platform to bring all of that to them. That to me is what's happening, and that's what to me is winning.
It's very interesting. I mean, just breaking that down a bit, get back to the question about what a lot of people get wrong is that, I think in marketing, there's so much focus on demand generation, right? And what's especially challenging in healthcare is the sales cycles are incredibly long, and the number of people involved in the buyer collective, involved in making a decision, are more than in other industries typically. And so I kind of think about it is that it's not like selling a $10,000 piece of financial services software where you've got a 30-day closing cycle, it maybe less, and you're just all about filling the funnel with as many leads as possible. It's about starting the right relationship in the right place in an organization, and then nurturing that relationship and expanding it over time. I mean, it's sort of, and that sounds like kind of old school, right? And it's an old school relationship selling, which is what we're moving away from. But it's trying to do that at scale and do that digitally, and that's incredibly hard. And it's particularly difficult when you're kind of measured against, well, how many leads how many leads are in the pipeline right now?
Well, I think I agree. And I share that what I still find believable is people look for what's trusted. Now, I believe that our audience is more empowered than ever with information. The period at which in a sales cycle a prospective customer approaches an actual vendor for a demo, et cetera, is much later than it used to be, because there's so much more information they can get from digital or omni-channel marketing, if it's YouTube, if it's calculators, et cetera. So they're much more educated. And actually what's interesting is, and actually data suggests, as a customer starts working through a problem, over 90% of the time, that customer already has the 2 or 3 vendors that they think may solve.
Oh, absolutely.
This, right? And that's already coming to it. So now you say, if you're not one of those top 3, how are you getting in there? So really that challenge has to begin about more smartly aligning the right tools that are accessible, easy, and build the trust in that relationship. Great example to me is this concept of digital twins, because I think no matter what, if you're designing your own car or buying a home or selecting a digital informatics partner for a hospital, you realize that you want it to be unique. There is a personality and identity to it. So you want to be able to test the variables that are important to you. If I come into every hospital with, here are the 2 ways to reach ROI on length of stay and mortality, many eyes are going to glaze over because they may see that their challenge is leakage or provider availability or staff turnover. And we need to allow people to arrive at those conclusions on their own, not just telling them. And so I think part of that journey of arrival is very, very important in providing customers with the right tools that they can become educated on.
You use the term of digital twins. What does that mean?
So I think digital twin usually relates to oncology, et cetera, as you see physicians using a mirror of a patient, where really what they're doing is being able to test different variables, different hypotheses, and different courses of treatment. Well, in business, it's the same thing, right? If we're able to model out quickly and electronically, how will the solution aid us in arriving at an optimal solution? And again, many times, all of those variables are not understood, right? There are probably 2 or 3 intrinsic variables that a customer may be very focused on. And usually that's one that's driven by the leadership imperative.
How do you do that? I mean, I obviously get the notion of A/B testing and multivariate testing. And I use it all the time as a way to improve the effectiveness of emails and, marketing a webinar or testing different messaging. How do you do it if you're tracking a relationship over time? How do you do what you've described there, which is, I guess, about personalization, right? You're trying to find what resonates most with the person that you're selling to, as them as an individual versus selling to somebody else. I mean, it's sort of, how do you do personalization at scale over long periods of time?
So I think almost as though very similar to the data that's being collected every time we engage with an app, as we approach gated content and we're able to watch people over time engage with that gated content and test different variables, that information is informing us about what's important to them, or even potentially what's curious to them. And no matter if it's in the Pareto's 20% or the 80%, then we can actually test that by pushing other ideas or variables towards that online calculator or tool for engagement. And really that allows us to build that over time, right? And you're building that relationship, that engagement. Now, I also do feel as though many times in marketing, we're not persistent enough in our engagement. And that doesn't mean cold calls, following up. It's really providing more information, right? If we're able to, rise the tide or buoy information for an individual that's curious, and we are able to direct that to them, that eliminates some of the work that they're doing independently, it's going to make that successful, right? So, the more information we're directing that's concise and specific to their interests, the better. And so as we're moving that process of engagement along, it's really being able to take the data and curate nurturing content. So for example, if, following through with this digital twin concept, if, for example, Adam, the individual is really interested in understanding patient flow, where patients are coming to and where patients are exiting in the system, we can actually try and bring some peer-reviewed evidence that supports that notion and the different variables that are included. And so we're actually trying to make sure that their learning process isn't just a single vector.
Right. It's really interesting. And it's such a hard thing to do, particularly for smaller companies that don't have the resources, because it takes an awful lot of content and a system for delivering it so that you can track the breadcrumbs, right, of somebody's journey, and then actually analyze that and gain some insight that'll help you improve what you're doing. I want to talk about a notion that you talked about. You mentioned, you said trust. And, trust, I guess, it also relates to brand. You've been around the block. So have you seen companies get that right? And have you seen companies just completely blow that? I mean, how do you build trust in the market that we're in?
So I think there's a lot of interesting ways to look at that. We see brands and organizations that align with athletes that sometimes get trust wrong, right, and get identity wrong.
Yeah, right.
Then sometimes we see it go really right. I believe as we look at healthcare and brands, there's a difference between awareness and availability. And of course, I've left the big monikers of GE and Philips. So, Equum's not on everybody's, tongue yet, but it will be soon. So to me, I think the difference between awareness and availability is awareness. People might say, oh, I've heard about Equum, right? I might have read a blog or a post. But when I think about availability, it's mental availability. It's this idea that I have a problem, and for some reason, Equum Medical as a brand comes up and is considered as an actual solution, for my buying situation. And I think that comes through, honestly, a longer cycle of engagement and sharing information. And really, I think as our brains kind of advance through time, and I look at my own kids, Adam. I always joke 15-second videos are now the way of communication, right? So I think we're less tolerant to try and go through an immense amount of information. We need that distilled down very simply, but we need it continuously. Because what we'll also do is brands are forgetful, right? We can forget brands and interesting events if we don't have that continuous stream and reminder that what they do is important to us. And so for me, as you said earlier, I think this idea of purposeful messaging that's built over time, right? So, people call it random acts of content. That's not what we're trying to do is, push out one idea and measure if it works. We're really trying to systematically build a theme and a bridge across everything we're doing. Somebody who I think did that remarkably well was Steve Jobs at Apple. You would start 9 months before the launch of a new iPhone, and he'd begin by talking about how, we didn't like things that were really big in our pockets or in our hands, or we didn't like wires on headphones. And frankly, none of us realized we didn't like it till he told us. And then when the solution came out 6 months later and said, look, here's the new iPhone X. And by the way, it's wireless and it charges without you plugging it in. We all said, absolutely genius, right? So again, there is a mental battle in making sure we're connecting the needs of our customers that are relevant today and ever changing dynamically to what we're delivering as a solution.
So it's quite interesting. What you've got me to think about is the notion that, when you're creating content, people are much more interested, actually, in many regards, in reading about a problem than they are about a solution. And I think that's part of trust as well, because you've got to, I guess one of the foundations of trust is that, you have something in common, and these people get, the people who's trying to sell to me here fully understands the problem and they've articulated it in an interesting way. And it's only when I really buy that they get my problem that I'm willing to actually listen to what they might suggest as a solution. Because until I've, if I don't buy that they get my problems, their solution can't possibly be right. And that's what I guess what Steve Jobs was doing, was selling you on you had a problem, and then ta-da, here's the solution you've been waiting for.
Yeah, he did a reasonably good job of that, I
Oh, he
think.
did. Yeah, he did.
But
They haven't done too badly,
yeah,
even without him.
but I even see it in some of the talent coming up through university now, and really that idea of purpose, right?
Mhm.
I feel if I can communicate and articulate our company's mission and vision very simply and speak about purpose, it resonates and it's much more genuine than if I just talk about our goods and services.
Yeah.
You know, even at Equum, Adam, one of the first things we brainstormed is what are we trying to do? Well, the challenge is we have, doctors and nurses and care staff teams, and we have patients, but we're not equitably level loaded, right? It's like two glasses of water. One's a quarter full, one's fully full. Everything works better if it's half full each, right? If we're trying to serve a table. So that concept of level loading, et cetera, was very critical to us. And ultimately, what was genuine there was our mission is to unlock that provider productivity that's not unlocked because of telehealth, because of proximity and geography. Yep. And all of a sudden everybody said, oh, I get it. Right? Why would we do that? Why would we all of a sudden take all of our providers in a certain city and make them go into a command center? Why would we do that? We don't do that to Uber drivers, right? Right. No, we don't have a big bus. We have distributed, federated network of providers. And that's exactly what healthcare so far is just on the frontiers of, right? And as consumers, everything through our lives in the past 2 years has been virtualized. Our entire life operations, from banking to shopping to working to dating, is completely transformed, and it's convenient. It's convenient. I can have Starbucks delivered if I want on my doorstep. However, I can't have my prescription delivered, or I can't see a physician when I need to, and I still have to wait for an appointment. This is what telehealth has changed. It has made healthcare, in the broad spectrum of things, more convenient and accessible. And I think in a country where we do see such disparity and equity, that is actually going to help. It is going to solve some of that inequity.
Well, and what's so striking to me is what you're describing is that, the thing that the Simon Sinek notion of you start with why. That's your why, your purpose as a company is about equity. It's in the name, right? Equum, equity. It's there, you clearly, the passion you speak about it is genuine, and that's such a fundamental foundation of great marketing and great brand marketing, is to really passionately believe in that purpose. You've got to be the evangelist for it.
And I think to your point, also the boundaries of being a competitor have to be grayed to really be successful these days. So it is not hardware versus software versus services. Really, customers want all three. And so if we want people, process, and technology to lead to a better healthcare world, then we as marketeers need to make sure that we have a blended message that supports other markets and other products and other companies. And again, I think that really reinforces that idea of disintermediation. At the end of the day, when my my automobile's in the shop getting fixed, I want the solution to be a fixed automobile that's operating, right? I am expecting that through that supply chain, the parts, the people, the technology to make it work are all going to work together. Now, interestingly enough, in healthcare, we still divide those. So I really think there's a massive opportunity to market that community service concept and bringing together and uniting those disparate pieces.
Absolutely. Well, Karsten, I could talk to you all day. We've got to wrap things up here. And I'm going to ask you the question I always ask all my guests, and that is, if you could go back in time and give yourself one piece of advice, what would that advice be? What's something that's going to be helpful to folks listening to this podcast?
Well, that's a tough one, but I'll tell you this, coming from a background where I didn't think I would move into healthcare, and moving into healthcare and interviewing people that want to make the leap into healthcare, coming into healthcare is about having the purpose and the meaning to want to deliver care. Just because I'm not a doctor doesn't mean I'm not helping people. As you are expanding knowledge and access yourself, Adam, I think it's critical. So the key to me is understand and be able to take your key assets in your marketing toolkit and apply them to healthcare, just as you would in a consumer role, a retail role, a banking or financial role, et cetera. And right now, we're seeing that happening in healthcare. We're seeing those great divides between consumerism and med tech and healthcare coming together. So for me, I think I always say the best thing I've been my entire life is curious. So the more curious we are, the more trouble we get into, the more friends we make, and hopefully more solutions we can create.
Yeah, I love that idea. Well, Karsten, thank you. It's been such a pleasure having you on the
Adam.
show, and really, really grateful to you. Before we go, I do want to let everybody know that you can subscribe to this podcast on Apple, on Spotify, whatever your favorite podcast application is, and you can view the video of this interview through a link in the podcast or through my website, Health Launchpad. We've got more guests coming up. We've got a calendar built out for the next few months. So do subscribe. And thank you to you, dear listener. And if you've got a topic that you'd like us to cover, you can email me at adam@healthlaunchpad.com and or find me on LinkedIn and just let me know what you want to talk about. So thank you, Karsten. And thank you, everybody else, for listening.